Hi everyone, I'm Dr. Pranjal Jain here to concise and compile difficult stuff for you to make easy for your NEET PG exam. Today we have named surgeries. That is all the important names of various surgeries through your GIT and Eurosurgery. Let's start. First off, we have the GIT surgeries and majorly the esophagus and stomach surgeries. So let's start. CHPS or congenital hypertrophic pyloric stenosis. That means the pylorus is very thinned out or stenosed. So we need to cut the pylorus, which is called as Ramsted pyloromyotomy. Don't pay attention to the first name here. Pay attention to the procedure. So pylorus pyloromyotomy. Okay. Then achalasia and GERD. Both are the problems at the esophagus stomach junction. Now achalasia cardia. It is the defect in the cardiac portion of stomach. So the surgery here would be cardiotomy, known as Heller's cardiomyotomy. And for GERD, it would be fundoplication, or the fundus of stomach is closed more tightly, so there is no reflux here. Nissen's fundoplication. Coming to esophageal cancer, here the main operation is to resect the affected part of esophagus. What are the approaches for the same? We have three names: Mecnion, Ivor-Lewis and Oringer. So see, Oringer, O seems like a hole or a hiatus. So Oringer is a transhiatal approach for resection. Ivor-Lewis, ivory cages होते हैं. So ivory cage is something like our rib cage or our thorax. So Ivor-Lewis is a transthoracic approach, while Mecnion would be a en-bloc approach. Okay, so Mecnion, Ivor-Lewis, ivory thorax, and Oringer, O for transhiatal. Then surgeries for hemorrhoid. There are two named surgeries, Milligan-Morgan and Ferguson. Milligan-Morgan is an open type of surgery. M&Ms, if you want to eat M&Ms, you need to open your mouth, right? So M&Ms is an open type of surgery. Ferguson is a closed type of surgery for hemorrhoid resection. Pilonidal sinus, it is located just above your buttock area. And when we say buttock or butts, the only name that comes to our mind is Kardashians. So something that sounds like that would be Kariadakis surgery. And last, rectal prolapse. Here we have two kinds of approach: an abdominal approach or a perineal approach. If you want to do the abdominal approach, this is the abdomen. You need to cut here. You need to rip the walls of the abdomen. So Ripstein and Wells are your abdominal approaches, and anything else is your perineal approach. Clear? The last of GIT surgery is sigmoid volvulus. Sigmoid is significant, and who's the most significant person in a country? It is the Prime Minister, PM, or the Paul Mikulic's surgery. So significant sigmoid volvulus, PM. Hirschsprung disease, here we have three surgeries, but it's better not to get into the difference between all of them. Just remember the name Swenson-Duhamel-Swab. Swenson-Duhamel-Swab. Once again, Swenson-Duhamel-Swab. That's it. Just remember this much for Hirschsprung disease. Anal cancer is N for Negro regime. This is a chemotherapy regime used in anal cancer. Moving on to surgeries in urology. Peyronie's disease, it is due to the fibrosis in penis. So it is like a ill-formed penis or a bent penis, right? So surgery here is Nesbit surgery, as if someone has taken a bite from one side, so it is bent. For BPH, that is benign prostatic hyperplasia, we have three surgeries. Again, an interesting concept here. BPH में basically we need to remove the prostate, but the difference in name of surgery is how you approach the prostate. So Millen, Freer and Young. If you end up having a brawl with someone, having a fight with someone, what do you say to them? पीछे मिल, मैं बताता हूँ. पीछे मिल, पीछे और रेट्रोप्यूबिक, पीछे मिल. Young people of this generation, what is their only goal? They only aspire to go near the perineum. So young surgery is perineum, and Freer is the left out option, that is suprapubic. So पीछे मिल, retromilin, young people perineum, Freer suprapubic. Now, the last lot of miscellaneous surgeries. SMA syndrome. What is it? SMA, cast, Wilkie syndrome. Basically, the superior mesenteric artery is being compressed between the aorta and duodenum or the left renal vein. So it is compressed somewhere here. In order to make space for it here, you need to pull these two apart. You need to be strong to pull it apart. Strong procedure. Thyroglossal cyst. Thyroid is something like this, and this is the thyroglossal duct. And if a cyst comes here, we can say this is a trunk of thyroid. So thyroglossal cyst excision is cyst trunk operation. Umbilical hernia ke liye we do the Mayo surgery. Okay. Coming to the last slide, and the reason for putting it last is because I really don't have a trick for this. I have been always confusing these two since forever. If you have a trick for it, please comment below. The surgery for duct ectasia is Hadfield surgery, and for intraductal papilloma, it is microducectomy. How I remembered was papilla are microstructures, so microducectomy for papilloma and Hadfield surgery for ectasia. But if you have something better, please let me know. And with that, we come to the end of this video. Hope you really enjoyed it, and if so, please hit the like button and don't forget to subscribe. Thank you.